A decade ago, health workers near the Liberian and Guinean border in Foya District, Lofa County, confirmed what became known as Liberia's first two cases of the deadly Ebola virus. That was the first wave of the virus, which killed all victims in March of 2014. Barely 2 weeks afterwards, the second wave started on April 6. By the end of April, Guinea, Liberia, and Sierra Leone had been fully engulfed, with the virus nearly bringing the three minor river union countries to their knees. Little did health authorities know that the virus would soon spread throughout the country, instilling fear among the population, exposing the vulnerabilities of Liberia's poor healthcare sector. Families were left devastated and in despair by the epidemic, with health and frontline workers bearing the brunt of the impact as many lives succumbed to the virus. And 8 years after the region was declared Ebola free, both relatives of victims and survivors are yet to come to terms with the scale of the devastation left in its wake.
Well, it all started 2014 when my daughter-in-law went to one Goodwill clinic around the 72nd belt. She went to give birth, and then we didn't know she attracted the virus there. But then she stayed there like 2 days. The third day she gave birth, we took her home. And then we took her home, we observed she started, going to the bathroom fast. Then we took her back there to see whether they could do follow-up about the case. But then unfortunately for her, she spent another day there and passed out. The doctor did not inform us properly because we asked whether Ebola. The doctor said no. The lady died from cold and pain from birth. So we kind of like bury her at town. And we buried her at town. 14 days later, my daughter, who was at the Cassidy Barry, was taking care of the baby that they had. The baby died exactly 14 days after the mother was buried. And then my daughter too came down with the virus. The next day they told us, well, we'll take her to GFK so they can do actual tests and see what's happening. And I was in the ambulance with them. We went to GFK. Just before reaching GFK, she gave her the ghost. So there and then I knew that Ebola was real.
The rapid spread of the virus across the country following the initial outbreak in Foya overwhelmed health workers as they grappled to understand the nature and means of containing deadly virus. In no time after the outbreak in Foya, the virus was on the rampage, leaving thousands dead as health workers struggled to understand it.
This is about what happened in the entire country. No one could have written a book, Collapse and Resiliency, the inside story of the Liberia unprecedented Ebola response. This is the real account, the real inside story of the person who led the outbreak as the incident manager. So we thought to tell the story so that the rest of the world can know that this was documented to provide education, the history of the Ebola outbreak, what went wrong when the international partners came here, what the communities did together, the issue of leadership, partnership with international organizations, and the experience that the rest of the world learned about Ebola.
When the outbreak took place, at the time, the health system being emerging from scratch as just rebuilding basic health services, we were not prepared at the time. So you notice that at the level of most of the hospitals, there were lack of medical supplies, like in burial nursing, those supplies that you will use in order not to come in contact with patients. So when we had the outbreak, I personally came in contact with one probable case. And we had a lot of issues where I even started to have a high blood pressure. And I sat with myself and said, at the level of the emergency room, we don't know those cases that are coming. So I had to face my fear. And I decided that working at the level of the treatment unit was going to be safer because I exactly know that I'm coming in contact with confirmed cases. And at the time, there were supplies at the level of the treatment unit. So I actually decided to move towards the treatment unit.
The cases and death toll of the deadly Ebola virus disease increased daily, reaching every nook and cranny of the country. In some communities, entire families were wiped away by the virus during the early stages of the outbreak. This was primarily due to many factors, including denial, lack of awareness, fear of being taken to Ebola treatment units or ETU, and other health facilities. There were also moments where Christian leaders defied the odds and laid hands on patients in hopes of providing cure for the disease, while imams from the Islamic faith bathed their dead in keeping with their rituals for handling dead bodies.
I was an evangelist, working in the church as an evangelist. So I went to their house to visit them. When I went, I saw her the way she was cheering and the way she was not feeling well. I could not touch her, but I prayed along with them. Sharp 12 o'clock, I saw my phone ringing. When my phone rang, when I picked it, it was him. He said, Robert, it's not easy right now. Please come. Because we Liberians, we have that sympathetic mind. We love, to help one another. No matter the crisis, people say we shouldn't touch one another, we shouldn't visit one another. Before when you see somebody, don't go around the person. I took that into consideration, but I still went to their house.
Unfortunately for us, we entered in one of the community members' yard. They were very close to me, and I didn't know exactly whether they have come down with Ebola, but we heard that people was dying. When we got to them, they said, "Oh, it was family to family having medicine and trying to put medicine on each other, so it was not something related that related to Ebola." So I shook one of the family's hands, and later, within 2 weeks, started coming, feeling all of the symptoms of Ebola, and so I first of all denied that it wasn't Ebola, but then I was taken to the Redemption Hospital, and I was diagnosed positive for Ebola virus.
Then when I came home, I actually did not know that my wife passed out because all I know she was taken to JFK and probably she would be well, I go well. But then we came home asking the children keep, dodging me. Oh, Papa, the woman, all right. She say, you must call her later on. They didn't want to tell me because we are still together for 9 years. So I seen down to my mother-in-law to came down, and then she too died. The group came and carried her. Then my son-in-law, who was in the army too, 3 days later after I discharged, he too died in the ETU with the child they had. So I lost like 7 persons from my house in that process during that short period in September and early October.
When I was to the hospital and no family showed up because everybody was afraid to come around me. Because they never wanted to go to the ETU area, so everybody was afraid, nobody came around me. Because especially my mom too, she was really, really afraid. Old age now, when they say, oh, when you do the one to the other person, you will get in touch with the virus, so she was afraid. But she was, according to other people that were around her, she was just into crying, but nobody showed face. When they were carrying in the ammo there, people were around taking photos. Facebook, quick to go worldwide.
As the death toll rapidly increased by the minute, The sound of the ambulances running at breakneck speed to convey the sick to various ETUs became terrifying for the entire nation. Neighbors who usually stand in their various homes weeping as they observe which homes the ambulances were headed. There were less number of survivors that were among those taken to the ETUs.
I can remember at the peak of the outbreak when we were hitting close to 500 to 700 cases of a day during the months of July, August, September of 2014. It was the real peak of the outbreak where cases and deaths were escalating, and we had to build treatment units across the country.
And you believe while we there were like 47 in a tent, open tent. And every time you lecture with somebody and they tell you, oh, Mr. Shu, I tell you, man, let me go rest a little bit. Before you make up your mind, in a split second, they're gone. So out of 47, we came down to 13. And we were 13. After, like I said, 13, 14 days, I was discharged. But before I was discharged, I was normal like 13 from 47. Person that lived.
The ORC at then, or whosoever that were in charge of the Island Clinic Hospital, said that there were no bed here. We have to wait until somebody die. And while we were there sitting in the ambulance, two of our colleagues, because we were 4 in the ambulance that left retention, 2 of them died right on my lap, giving up, vomiting with blood, and all over the body, and the diarrhea in my hand. So we had to demolish in the ambulance, but still waiting. Nurses were not coming in to provide the necessary food that we were supposed to get. I met a crisis already in the ETU that the ETU health workers were demonstrating. And so medications are supposed to give, they were not giving food they're supposed to give. Of course, your family have abandoned you already, and you're looking up to government to provide meal, and you cannot get meal. The next morning, the 8 colleagues that were lying down near me, and I was lying in the center to make them 9 in Liberia. 8 of them died.
Whenever an ambulance left a home, the entire surrounding was quarantined for 21 days to contain the spread of the virus. However, logistics and other means of support were in short supply. This made it difficult to effectively contain the epidemic.
Yeah, we cannot sit and be waiting to die. No food, no medication. We should just be lying down and die. So when I check in my phone, even though they told not to care for me there, I check in my small body phone because my family were there communicating with us. And I saw one of the journalists, number from EFBC in there. So I decided to call him. And I called him and said, who's this? And I hid my identity. And I said I was Peter's Moluba. And then he said, from where? I said, from the JFK ETU, we are about to break and go out loose because there's no food, no medication. Nurses and doctors are demonstrating. But the jailer asked me, what can I say? As I speak to you, one of our colleagues is giving a ghost. From this morning, he have not eaten, he have not taken his medication. So we cannot wait. We are calling on all the residents around the 20th Street and the rest of the surroundings to evacuate. Those of you that get your store, your shop, we just want you to leave your store open. We are not coming to harm anybody. We want to just get full cooking utensils and get back to the ETU so we can eat and survive. And he asked her, why they're not giving you food? We said, well, because the nurses, I told you the nurses and doctors are protesting and people are dying. So right away when we were talking, we started throwing the bottles of juices that we face, looking like urine, into the community. And the noise from the community group, drew the journalists' attention.
So my second treatment unit was the one in Ganta that was also taken care of by one international NGO called the Project Concern International. There were medication always involved, available. There were feeding always available for those patients. I don't want to dispute the fact that there were challenges, But I strongly believe it was at the onset of the outbreak.
Hospitals and other health facilities could no longer respond to patients due to fear, limited spaces, and other factors. On the other hand, people were afraid to visit health facilities for fear of not returning alive. As the death toll increased exponentially, the government faced the challenge of identifying sites for safe burials. So, it resorted to cremation, which the population saw as strange and culturally inappropriate. These factors led many preferring to keep their sick relatives at home, though it contributed to higher case load. Some only visited the hospital when their conditions have deteriorated, leaving limited chances for survivors.
I went back home. When I got home, I asked, oh, Fatu, the sickness is getting worse. When I went to the house, after opening the door, I saw a real heat like a fire coming from the lady.
Because initially people felt that Ebola was just a death sentence, and over time we started to concentrate on key messages of prevention, that even you can contact Ebola and survive. So based on those things, people started to change their behavior. That you are not satisfied with yourself, you think that you have come down with the virus, you report to the nearby, health facility.
So honestly, we healthcare workers, we got our ethics. There is something we call do no harm. No matter the case, we don't do harm to our patients. And during the outbreak, we were also thinking about our own lives. Why do we want to be taking people's life? So there were no specific pills that was given to say this is intended for the EVD. Those patients who were confirmed, they were symptomatically treated. For example, if the patient is passing watery stool, we're not giving pills now. We also want to treat that aspect of it, either by giving you fluid, maybe adding some tablets in order to stop the running stomach. But there was no specific pill that would be given to you to say, take the one if for EVD. No, it wasn't the case. There were people who survived EVD and you are aware. There were other people with that misconception that as long as you are confirmed and you go to the treatment unit, you wouldn't come back. But the thing about treating EVD is that the earlier the symptoms are tackled, the better outcome for the patient. But many of our patients that we took from the community, they were people who were already presenting 2, 3, 4, 5 symptoms. So in combating people at that stage, it's a difficult thing. This is how you found out that most of our fatality came about. When I left the island clinic, my treatment was a smaller one. I didn't see that, but there were reports that people still felt that they would have been killed by other healthcare workers. So it is possible that those things took place, but I didn't see it as a clinician. I think it's time that we rebuild the health system. It's time that we Liberians be honest to ourselves. Like I said, the health system back then is not what we have today. We have a broken system. The health system we have back then is not what we have today. So we need to be honest to ourselves. If there should be an outbreak, can the current system face it? The resounding answer is no. So we need to be honest to ourselves. As authority, the government needs to do more in order to farm up this health system. We need to make the health system a very vibrant one. And finally, there are a lot of healthcare workers who also passed out during the Ebola outbreak. And those are people who their family did not get anything. We are still hoping that the government will have to step in. And at this time, I want to salute all of the brave healthcare workers who tirelessly worked and saw that this country was liberated during the darkest period of our health history.
I think the health system is prepared. And the way you know that the health system is prepared is two, 3 ways. The first way you get to know is what happened during subsequent outbreaks. How did they respond? How did they fare? The next thing is you look at is how knowledgeable, what are the infrastructure, the resources that have been put in place. That is what you call the epidemic preparedness. How prepared are we to respond? So when it comes to preparedness, because of the first large outbreak and its impact, communities are now, even healthcare workers are now more aware, right? That's the first thing. Healthcare workers are trained, there are clinical guidelines, there are rapid response teams, there's the integrated disease surveillance and response system. This is managed by the National Public Health Institute. You have healthcare workers in all health facilities. They're looking for certain diseases, among which is Ebola virus disease. When you go to the hospital and you're sick, they ask you for symptoms. And depending on the symptoms you're experiencing, they can suspect that, oh, this patient, these symptoms are consistent with Ebola. And quickly they'll trigger what we call the surveillance system, meaning the informed surveillance officers. The surveillance officers will come, do the investigation, get all the information, contacts about the patient, and then invite the laboratory team to come take samples and test them to confirm whether the diagnosis. And you can see that the National Public Health Institute and Ministry of Health have really been doing well.
If you use an indicator in terms of responding to diseases, if you use an indicator as the COVID-19, so though COVID-19 is not the same as Ebola, their transmission are the same, the way they catch people not the same, the way they spread not the same. But if you use how where Liberia was able to respond faster, and African countries, you can say that some of those systems that we put in place were working in terms of disease surveillance, tracing of contacts, managing cases, finding treatment, building up an incident management system quickly. I think we learned some lessons in their capacity building. In terms of the overall health system of the country, there are indicators that you have to look at first to see how the performance system will before you can run out any judgment.
The nation became pathetic, drawing the attention of the international community. There was a need for health emergency, awareness, and adherence to public health protocols that provided information on containing and preventing the spread of the virus. As the situation worsened, on August 6, 2014, Liberian President Ellen Johnson Sirleaf declared a state of emergency. Under the state of emergency, the country's borders were closed, internal travels were restricted, and the much needed assistance sought from international partners, including the United States. Commercial activities were also limited. Places of worship and large gatherings were prohibited, and workers at various places were reduced to only staff on essential duties. The government, international partners, civil society organizations, and the citizens got involved in the fight against the epidemic. At the entrances of many communities, residents set up hand washing stations, carried out contact tracing, created awareness on social distancing and the eating of dry meat, which was believed to be the carriers of the virus. After the government and other international public health organizations established more treatment centers to cope with the influx of sick people, the media became an important body in the fight against the epidemic. They broadcast jingles, dramas, news articles, and other awareness programs on their platforms that educated the public about the virus. Not to be outdone, musical artists also made significant contributions. They produced songs that resonated and appealed to the public to adhere to the public health protocols. As the public health messages and materials became clear to the citizens, the number of cases began to reduce. A report by the World Health Organization in 2015, Liberia recorded more than Ebola 10,600 cases, of which more than 4,800 died. Liberia was first declared free of Ebola in May 2014, but the virus soon resurfaced twice thereafter and even flared up in November of the same year. Liberia was finally declared free of Ebola on January 14, 2016. The Disco Hill Cemetery became the final resting place for victims of the virus. Survivors explaining their challenges, health complications, and how they were accepted in their community.
Having survived, coming back and be reintegrated into the society, you expect family members first to welcome you, but they did not welcome me. My family was ostracized by my own family and community members. My wife could not go outside. I have to come and go in the market. Even going in the market, there was an issue. Community members were a little bit jittery, feeling that I still had the potential of spreading the virus. And I was not playing major role within the community anymore like I used to do prior to being infected with the virus. Even at the social gathering, when 3, 4, 5 months passed, I decided to go and sit in the entertainment areas, far away from my community. While there, I think normally when you get in the entertainment area, you buy some drinks. Make life, trying to see how best you can recuperate, bring your life back to where it was, And 3 other ladies came in. Normally, those social friends, girls, when they come in the club, they see you having the most talk about table. Everybody want to come closer to you to sit in. So 3 of them came and said, "Why are you alone just sitting here? You having the kind of bottle?" I was not actually drinking. I was just there. I was drinking juice. I was just there, trying to keep my mind away from what had happened within the ETO. And they sat with me. They started drinking. Say you offer up. We say we take it by force, and they started to drink. And being the president of the survivors, most of the entertainment centers, they have television. So the news brought, ABC came up with news, and the Patrick S. Farley plead on behalf of Ebola survivors as president of Ebola survivors. When they saw my photo, and I sitting right in front of them, the first one went in the bathroom to pass water. The second one photo, the third one photo. Send a letter, I haven't seen them. Sometimes I take them to be ghosts, maybe people who die from the ETU. And some of my friends who passed on from the ETU. That was a social power, not working in the community anymore. Economically, I lost my job where I used to work. I used to take care of over 300 employees. I used to work in the rest industry. Then I lost my contract because of stigma. In terms of complications, after the 8 years, 10 years, whether there are issues, there are still complications. There are still back pain, there are still joint pains. From a general perspective, because I don't like as a president to speak on behalf of my family and myself, though there are impotency within the survivor society from reported from few of our colleagues from Nimba and Bond County. There are women who have not seen their menstrual period for so long time. Sometimes it comes just the auto rain, it just come in, just that kind of way. So they reported that to us. We got the facts running because we had the John Snow Incorporated, sponsored by USAID, was providing advanced medical treatment for our colleagues. Some are blind, and some having a spinal cord problem, because they say the virus has the propensity of the ability to be in the spinal cord. And there are a lot of other issues that socially, economically, there are children, adolescents who used to, take and, depend on their parents for livelihood. Now they have become breadwinner for themselves and their siblings. Two specific cases in Banjo community. She was around 14 years old, and she has siblings, 2, 8, and 11, and she was 14. But 14 family died in their house, including the entire family, or wiped out. She left there. She called me. We directed her to NGOs. It could not work, and so she began. 2 years ago, I saw her, and they reported to me that she became a prostitute. She had to feed her siblings. Can you imagine? At then 14 years old. So, but now she's supposed to be somewhere around 20 plus. And we are still working on modalities to see how we can get international partners. But there are still major complications with survivors in this country in terms of serious medical complications. Can you imagine you come from the ETU, and then with the psychological impact, the stress, and trying to recollect what happened there, and then you come as a man that you are impotent, you have already lost some of your family members, your children, and you're thinking, oh, well, I think I will get a partner to have children. And then the stigma is there. They have to relocate from their own parent house to go to another house, another community where they will be paying rent because they have been stigmatized in that community. And so financially, the difficulties, socially, the difficulties, and medically, the complete difficult situations that survivors are going.
We conducted a study. We initially intended to enroll all these Ebola survivors in a study. We were able to enroll close to 1,000 of them, over 900. And each of the survivors came with close contacts. Close contacts are family members or sexual contacts who came in contact with the survivor around the time they had acute Ebola virus disease, meaning during the outbreak, right? So our study had around close to 4,000, 3,000, a little over 3,900, right? And we followed them for 5 years. They came every 6 months, and then we did physical examination. We asked them over the last 6 months what symptoms and they were experiencing. We examined them. We ran some blood tests, some urine tests, and we, multiple tests to understand. So we were able to get high quality, accurate, independent data, right? Because you compare Ebola survivors to the general public, right? Their close contacts, and see what are they reporting, right? Without bias, right? And see what's the difference, right? It's the difference reflecting survival. So through that study, the Prevail 3 study, we're able to identify 6 symptoms that were more common in Ebola survivors, right, than the general public. And those symptoms included headache, right, muscle pain, fatigue, uveitis, right? These kinds of symptoms, were more common in the Ebola survivors and general public. So we concluded that these were the most important complications that result, after people survive from Ebola. Follow them over time for over 5 years. We're able to see that during that time, these complications clear for some survivors, right? But all the way to the end of the epidemic, there are few that still had these complications looming. I know you asked specifically about other symptoms about menstrual irregularities, and what else did you say?
And erections for males.
Yeah. So we didn't see significant difference, right, between survivors and the general public for these other additional symptoms you're talking about. So We didn't find the evidence to be able to attribute them to Ebola.
Really, the stigma, it was really beyond us, especially the old community I was in. The stigma was beyond us. But I was not really having time because I don't listen to people. I only listen to God in heaven who will really carry me through, but I don't listen to people. Sometimes when you apply somewhere, people will say, oh, wait. And that stigma too, especially the community clinic I apply for, people are like afraid to accept it. Because other people in the community too knew that I went through the ETU.
Initially, right after the epidemic, Ebola survivors were highly stigmatized, right? People didn't, some families, some communities did not want them back, right? People thought that Ebola survivors were still infected with EVD and they were likely spread it to family members. So families went apart, some people lost their spouses, and some communities drove away these people. 2 years later, a lot of community work was being done, right? You had a lot of social mobilization, communication, local stakeholders, international stakeholders were telling the public that, look, Ebola survivors are not infected anymore. We were giving them certificates with their test results that they could share with their family members, with their relatives to show that they were no longer positive for survival. So with time, the stigma reduced.
On February 1, 2015, the governments of Liberia and the United States initiated a joint clinical research on Ebola and other infectious diseases.
Those studies were very successful, and I must say that those studies started in West Africa, specifically in Liberia. We had the phase 2 double-blind randomized placebo-controlled study of 2 Ebola vaccines, right? And those studies started in West Africa, the phase 2 clinical trials. Good data was generated. And remember, sometime, I think in 2017, another epidemic started in DRC. When you're having these outbreaks, sometimes you need real patients, real life patients, right? To see whether they are really effective. So those studies continue in DRC, and those vaccines have been licensed, right? They've been approved, they've been shown to be effective, and they've been licensed. There are 3 Ebola vaccines. The first one is given as an active vaccine during an epidemic through ring vaccination. So when you have an epidemic ongoing, you do what is called ring vaccination. Ring vaccination is one person is affected, everyone surrounding them that they came in contact with become the ring, right? So if you can vaccinate all those people and prevent them from becoming sick with Ebola, then that person with Ebola will be isolated, right? They're isolated in an Ebola treatment unit, and hopefully they get well. But these other people who have been vaccinated around them, hopefully they won't get sick. The vaccine is effective, right? And by that, the entire community is safe, right? And then there are 2 other vaccines by Johnson & Johnson Pharmaceutical and Merck Pharmaceutical. Those ones are given as prophylactic vaccines, meaning you don't wait for an epidemic to start, right? You can give the vaccines to before an epidemic starts. But because those vaccines are costly, you don't know when an outbreak will start. The recommendation is to be targeted. Instead of giving a vaccine to everyone, you don't have doses to everyone. You give vaccines to people who are most at risk of becoming infected with Ebola. You target high-risk exposed populations and vaccinate them, right? Once you vaccinate them and they are protected, once they identify a case of Ebola, they're able to provide care with confidence and knowing that they are safe, and hopefully you can also the outbreak is interrupted. But then, as an additional measure, remember I told you there's another vaccine that's given during an epidemic, right? Once a case is identified, then all those in the surrounding, in our community that is known that the patient came in contact with, they also vaccinate them as an extra measure to end the outbreak. So you will see that since that large outbreak in 2014 to 2016, we've had few cases here and there, right? Remember in 2021 and the end of 2016 and sometime 2017, and then in 2021 there were small flare-up outbreaks in Guinea. I think few of those cases ended in Liberia, right? In 2016 we had the cow field epidemic, a mother and then with her 2 children and her husband, and so. But we've never ever had that large outbreak anymore because we now have vaccines that were trialed in Liberia and other countries were shown to be effective. We now have a therapeutic or drug that was also trial in DRC, in addition to other drugs that we took through phase 2 clinical trial here, and then the trials continue in DRC. And those drugs, 2 of them were shown to be very effective, and they are now licensed, right, to be used to treat Ebola. And then in Liberia, the Ministry of Health has added the vaccines and those drugs within the treatment guidelines.
The vaccine study, the largest so far, proved to be efficacious against the virus.